place or your being there. So today it's a wonderful day. We are going to be discussing something that is very crucial in our society. We kind of try to neglect it, but yes, it is here, and very, very concerning. Last year, we had a shock during the World Mental Health Day run here in Uganda, when the Ministry of Health released a report that 1 of every 3 people you see outside there, 1 of the 3 people you meet, one could be battling with mental health issues, and that is a challenge. So that report left very many people in shock. And just this month, we have had police, majorly the Kampala Metropolitan Police, coming out to really urge the public about the mental health issues, because there was a rise in suicide cases majorly this month. Earlier this month, we have seen people hanging themselves. We saw one who hanged themselves down at the golf course here in Kampala, and of course so many people. We've seen people jumping out of buildings and all that. What is the cause of all this? It is of course issues to do with mental health. Today it is what we're going to be discussing. We're going to be navigating mental health illness and its challenges, and of course here with me today is Dr. Raymond Mugume, who is a psychiatric resident of Makerere University College of Health Sciences, and I want him to greet us here today. Good morning to you, Doctor.
Good morning, Luke.
Yes, please do greet our viewers.
Good morning, viewers. It's an honor to be here with you and to share with us the important topic of mental illness, which we've been battling for years. Yes. Meanwhile, except that currently everyone has a smartphone, so we are able to be aware of what is happening from every side of this country. And so it would be my pleasure to share with you these facts. You already know them. I will just be adding in a few facts here and there, and we see if that can increase our awareness within our communities.
Okay, very important. You're most welcome.
Thank
and
you.
Yes, we look forward to a very fruitful discussion. Our producer was very, very strategic to let one of our people here, Brinko, to be in studio to attend to such a session, because you never know. Anyway, what is mental health? Give us an overview when it comes to mental illness or mental health.
So I will break it down that mental health is a state of well-being, that you're able to cope with the normal stresses of life. You're able to learn and work well. You're able to realize your own abilities. And ultimately, you're able to contribute to your workplace. If you're a student, you're able to perform well in school. If you're within the community, you're able to contribute to your community. But most importantly, since this is a family TV, yes, we are able to contribute to your family. And so that is mental health in general. It's a state of well-being.
Okay.
And when we talk about mental health, we are looking at how you feel, how you think, and ultimately how you behave. So and every one of us, me and you, Luke, we have mental health already.
Okay.
But what happens is that every time we say mental health, people think about mental illness.
Okay.
So which usually and it's okay to have mental illness. Did you know? It's very okay to have mental illness. So you shouldn't fumble with mental challenges, mental problems. No. Say it as it is, mental illness.
Okay.
Yes. So that is what we talk about. When we say mental health, that's what we basically talking about. We're talking about, are you able to deal with the normal stresses of life? Because currently, I mean, we are challenged with the same consequences, with the same problems. Are you able to deal with them? Are you able to learn? If you're a student like myself and any other student out there, are you able to learn? If you're working, are you able to perform? Are you able to give the deliverables at work? Are you able to realize your potentials? Do you see yourself growing? Are you productive at work? Or that has since changed? And are you able to contribute? Are you able to provide at home? Are you able to, stand in for leadership if you're, planning for politics in the coming years? Are you able to speak in public? Are you able to give back to community? And so that's what we look at. And so when mental illness comes in, it affects all those parameters that I've talked about.
Okay. So what is mental illness now?
Now, mental illness, before you get to mental illness, we go through like phases. We have stressors, then we have distress, and then mental illness. So mental illness is more likely like the end of the spectrum.
Okay.
So when we say I'm stressed, what do you really usually mean? Usually mean that, usually when let's say you were walking down on these streets of Kampala and you get, your phone is snatched. That instant phase, that instant feeling that you get is what is actually called stress. And it is normal, okay? It is normal. Everyone does get stressed. In fact, it is one of the survival strategies of human beings, that being stressed actually kind of increases your resilience, okay?
Okay.
Then we have what we call distress. Distress, now this distress is usually when your coping strategies have failed. Let's say usually when you get stressed, usually take a walk, or you listen to music, or you go and read the Bible, or you go talk to someone. Now, in distress, that those coping strategies have failed. And also your social support, probably, usually you talk to your spouse, you talk to your friends. They are there, but they can no longer understand what is exactly happening to you, because your thoughts and your feelings and your behavior have diverted since from the normal. So that the distress. Now, when it does not, when those coping strategies and your social support fail, the ultimate cause, you not getting the help that you might need, results into you getting a mental illness. So it's not a one-day thing. It's not like you wake up, like how you get malaria, that you get a mosquito, then you take about maybe 3-4 days, and then you get malaria. Now, for mental illness, it takes years.
Yes, okay.
It's not, and it does not have a specific cause. We do not have a specific cause, just like we have physical illness. Physical illnesses, I'm talking about diabetes, hypertension, among others, HIV. We have specific causes that it's caused by a virus, it's caused by a mosquito. But for mental illness, it's a basket of many factors that causes mental illness.
Okay.
It can start from childhood, from your brain developing. So when we get born, our brain continues to develop until the age of 5 years. Okay. And anything can happen during that time. Let's say during that time you lose a parent. You lose a parent. Your risk increases about 3 to 4 folds to get depression later in adult life. If you're bullied, if your parents were not present, which happens a lot. If you're a child who was born in war, let's say for people who got born maybe 20 years when the Northern War was still there. If you were bullied in school, if you were picked up, if you were rejected, you did not have someone you attached to, someone who you felt safe around, that they would protect you during your childhood. All those predispose you. And then as you grow up, you find that maybe you're not performing well in school, maybe tuition is not there, you don't have the necessities, and then it goes on and on. And then later in adult life, because all these things have been coming up, you start to cope wrongly. What is coping wrongly? Some resort to using alcohol. So usually, depending on how alcohol makes you feel, if you are angry, you take alcohol to make you feel better. It becomes like your coping strategy, and that is a wrong coping strategy. As compared to someone who is angry, they decide to go and do exercise, or they go to the gym, or they take a run, or they take a walk, or they actually even go to the house of God to pray. It changes the narrative of this is a good coping strategy and this is a bad coping strategy. Okay. So that when we talk about mental illness, we talk about all those factors. And every one of us, me and you, are candidates of mental illness.
Okay.
And not just because I'm a doctor that I cannot get mental illness. I too get mental illness. So we have what we call the mental health continuum, that at any one point during your days, you can come in like to work when you're feeling very revamped to do the work.
Yeah, sure.
But by break T, which is maybe by 10, your energies have reduced. And then by midday, you're very irritable, you're angry, and you want your day to end there and then. And then by evening, your baby back to either normal, or you're more irritable, or you're actually now annoying everybody at work. But what buffers us, all of us, is that one, we have social support. What is social support? It is your perceived, social support means your perceived presence of people that they will come through when you need them. I'm sure everyone has a friend. But in you, do you perceive that if you call, let's say you were my friend Luke, do I perceive you that if I called you, I was going through a stressful moment, you will come through? So that is what we call social support. Okay. Each one of us must have a social support. In fact, I encourage each one of us to have social support. You should have a friend, if you have a spouse, but you should be this person that you trust that they will not use your words against you during those heated moments. Yes. And then the coping strategies, of course, those ones we shall dwell into them when we come to that topic. Okay. But those two usually buffer us from proceeding to getting mental illness, among other many other factors. Of course, your financial standing, your education level, if you're feeling satisfied at work, if you feel that your home is welcoming or it is not rejecting you, if you feel that your spouse is not cheating on you or rejecting you, all those come into play for you to get mental illness. Okay,
let us look at the symptoms. How do I tell that the Gundi could be mentally ill, or I'm now getting mentally ill?
Well, that is very good. So, how do you tell that someone is mentally ill? Let's start, before you tell someone, it can start with you. How do you tell you as a person you're actually mentally ill, or you're proceeding to mental illness?
Okay.
Once, it can begin with your energies, how you feel. Do you feel hopeful that the future is better? Okay. Do you feel that you have a purpose in this world? Do you feel that you're good enough to take on whatever challenges in front? How is your sleep? Are you the type that goes to sleep and then you spend more than 15 minutes rolling left and right to get sleep? Or when you sleep, you only sleep for 2 hours. Or when you wake up at around 2 to go and use the washroom, then you cannot go back to sleep until like later in the morning around 6. That's when your sleep again comes in. Those are symptoms. Those are signs. Okay. Your appetite has reduced greatly. You're either eating too much, or you even do not have appetite. 3, for you, when you're anything slightly small, your rage or your anger is like 4 times. Let's say I'm here and then someone just hits you a little bit. Your anger, it's as if you've been beaten. Like you're easily angered.
Sure.
Then for others, you are very forgetful. You can hardly concentrate at work. You can hardly you like isolating yourself. You like being alone. You no longer like to do the activities that you used to do. Let's say, I don't know if you love football. You no longer go to watch your football matches. You no longer hang out with friends. And those are feelings. And sometimes you find yourself crying unnecessarily. Okay. Like you're here at work, but then there's a moment you go to the washroom and cry. Or you find yourself in the bedroom, you're crying alone. Nothing has pissed you off, nothing has... but you find yourself crying. Or sometimes you're there and you have an intense fear that rises up, and then you find your heart is racing, you can hardly move, you're looking around. or sometimes you find yourself that you do not like spaces that have a lot of people, or you fear crowds. Others fear spaces, fear darkness, fear hate. All those are what? Signs and symptoms. But now, I need to make a disclaimer that it's good, it would be good if everyone made mental health their business. Not only left to the psychiatrists or psychologists or the counselors, but every one of us made it their business. That we are aware, because now at least information is on our fingertips, on our smartphones. And then the other disclaimer I wanted to make is that we ought to know that you having mental illness does not in any way translate to you being a weak person, being an incompetent employee, being a person who does not know how to deliver at work. It does not translate you into being a fugitive, okay? It just only shows that you're human. And so if we can understand mental illness in that way, that we need more compassion, more kindness towards people who are having mental illness, even the ones that you've seen on the roadside meanwhile, the ones that we usually label mad. Mad is a word that is prejudicial. So the word is mental illness, okay? Not mental challenge, not mentally challenged, not mentally handicapped, not mental problems. The word is mental illness.
Okay.
Yes, please.
And let's look at the complications of mental illness.
Now, complications. Complications are very wide, and we usually group them into those that are biological, psychological, and then social. What does that mean? That complications will affect you as an individual. Okay?
Yes.
So you having mental illness does not stop you from having other physical illnesses. If for any fact, mental illness can either lead you to get physical illness, like let's say you have bipolar, you might involve yourself in high risky sexual behavior, and you get HIV. Or you can have HIV and you get bipolar. So in other words, the mental illnesses predispose you to also getting physical illnesses. Okay?
Yes.
Because you lose touch with reality. Some people actually say they hear voices that other people don't hear, or they see things. They will tell you, I'm seeing someone, maybe someone died, but for them they say they are seeing them. Unfortunately, they usually relate that to spirits. Or for a very long time this has been the case, from time immemorial, that mental illness has been linked to spirituality. So people usually first go to the witch doctors, they go to churches. Usually they come to us as the last resort when everything has failed. Okay. Unfortunately, at that point we're also doing crisis intervention. So there are those complications that come with switching from home to the witch doctor, or to the churches. So by the time you come, we literally cannot do much, apart from counseling you. So there are those biological. Then psychological is that you lose touch. You're no longer productive at work. You're no longer what I would call purposeful to your family, to your friends, to the community where you come from. You're now stigmatized. Okay, the word is stigma is a very, very big factor that actually comes as a complication of mental illness. And then we have social, that your family abandons you. Your spouse abandons you. In fact, they say for us, we never marry from such families. But come on, these people with mental illnesses, once they're given the right support, they're as productive as me and you. They will have families, they will have children, they'll be productive at work, they will give deliverables. They just need your kind support as another individual. And so there are those. So it is quite a cocktail of complications. Yes.
Okay, that's interesting. So, and if someone, you talked about stress.
Yes, please.
Being
it's like the immediate. It's like a survival. It's good for survival for individuals, So everybody being stressed actually increases or strengthens your resilience.
Okay. Let's talk about interventions that can do. If I see someone having mood swings and all those things, what should I do? Or if I have such?
If you have such, that is a very good question. So we have what we call stepped care approach. Before you come running to see me, what can you do?
Okay.
One of the things that we can do is, let's say you have issues with your sleep, and this is tailored to the specific problem that you might have. If you're the person that you go to bed and you have difficulty sleeping or initiating sleep, maintaining sleep, or having satisfactory sleep, what can we do?
Okay.
One of the things is that we can avoid what we call caffeinated drinks. What are those ones? They include soda, they include coffee, tea at around 3 p.m. Okay? We avoid those ones. 2 is that we have our rooms where we sleep. They are not too hot, but also they are not too cold. There are some people who have ACs in their bedrooms. Yes.
Okay.
That inconveniences or interferes with your sleep cycle. 3 is that your the time you get to bed, it should be specific. It should be the same time every day and the same time that you wake up. So if you have decided that you want to sleep at 10, it is 10 every day. Okay. And if your time of waking up is 6, it is 6 every day. But what happens is that usually people during the week, they sleep at 10. When it is Friday evening, they sleep at 3 a.m. in the morning. And wake up on Saturday at probably midday or 2 p.m. So that interferes with your sleep cycle.
Okay.
So there are those things that you can do at home, but also doing exercises. Usually when people finish work, like this day will come to an end, they want to rush to go and they go sit in the cars or take borders or take taxis. Then when they reach home, it is just eating and sleeping. But I would advise that when you get home, just take about 30 minutes. You can even rotate around your house or in your compound. For those that have such big, for some of us that are still renting, you can decide to take a walk in the neighborhood for 30 minutes. So that you recapitulate, you rejuvenate, your body is able to rethink in a different way, but also it kind of releases off the unsaid stress, and then you come back.
Okay.
That helps you to initiate sleep better. Then if you're in bed and 15 minutes later you're not sleepy, you're not initiating sleep, leave the bed. Go to the bed only if you're going to sleep, not where you're going to. Some have screens within their bedrooms.
Yes.
The screen should be in the living room. Some carry their phones to the bedroom. Ideally, the phones should be left out of the bedroom. So the bedroom should be only for sleep. The light, the kind of light that it shouldn't be like this studio light. It should be the dim light that actually facilitates your body to produce the hormone for sleep called melatonin, so that you can be able to sleep. Yes.
Sleep seems to be a very
it is a very because once sleep is one of the risk factors for you to get mental illness.
Wow.
You will come very tired. You start your day very tired, very snobby, very irritable, and that of course will have repercussions to your friends. So you know that while you're dealing with your mental illness, 3-4 people around you are also being affected.
Oh,
does that make sense?
Yeah, it does.
Yes.
So how about oversleeping?
Oversleeping is also a problem.
Hey.
Oversleeping is also a problem, because once you oversleep, you wake up very tired. You wake up as if you're very sick, but yet you're not. You even go and do the malaria test and it's negative, or you do all these tests and you're okay. So oversleeping is also an issue. So and it is also a disorder, and so when you see you're oversleeping, it will be good to seek medical help.
Okay.
Yes, please.
So what is the best recommended time for sleeping?
The best recommended time, to be honest, it varies, but the hours of sleep that is recommended for me and you, since we are now adults, is between 6 and 8 hours.
Okay.
But we should keep in mind that the more as we grow, our threshold or our arousal, the arousal threshold kind of also increases. So we find ourselves, if you see like adults who are within 60, they kind of sleep less, they are more awake, they will tell you about things that happened in the night, yet for you did not hear them. So and for them it's even more recommended to put into practice what I've just shared with you. And again, I did not really tackle all the symptoms. I've just talked about sleep. But when we talk about depression, some people are really, they like to be isolated. He was a person who likes to be with people, but now they want to be isolated. That is for depression. They find themselves, they are crying unnecessarily. You will look at them and their eyes are red. They're either sleeping, not sleeping enough, or maybe they have resorted to using drugs. And drugs will include alcohol, include cocaine, include marijuana, because now all these drugs, heroin, all these drugs are within Kampala, within Uganda. Then we have, they no longer want to visit people. And this goes on for more than 2 weeks, because duration is also very important. For depression, we are looking at 2 weeks and above, that you've been sad for most of the days, almost every day. Nothing really gets you out of that sadness. That maybe in 7 days, you're only happy like 2 days. And then the other 5 days, you're really sad. Some start having suicide ideation. They start having ideas about suicide. They feel hopeless, they feel worthless, they feel like they no longer belong, they feel they are actually a burden to their spouses. So they start planning on ending their life. But what should be interesting is that before they commit suicide, in 1 month before they commit, or in 1 year before they commit, they have actually sought for help. You've heard them talk about it. I'm tired of life. They have actually also gone to the doctor. They have also gone to the counselor. They have actually even talked to you. They say, I feel life is not worth it. But what do? We tell them, we either gaslight them, we tell them, bija kugwa. It will be done in no time. And just hold in there. But he has nothing to. He has no hope. He has no hope for the next day. He has no hope for the future. So what do you want him to hope on? What do you want them to hope on? So it is the time then you need to signpost them to health facilities. And it would be very good that if every workplace actually had a contact. Do you know how you have contacts of suppliers and advertisement? To be good for every workplace to have what we call a mental health work plan. That you have a plan of, if your employee is dealing with a mental health illness or is dealing with distress, where do you signpost them for care? And those are now very available. There are many places, as I will dwell into them as I conclude my discussion. So those are some of the signs and symptoms. There are some
how
people,
about mood swings?
Mood swings now, mood swings is, it's not a symptom per se for mental illness, but it does happen with mental illness, okay? In some people, for ladies, sometimes they say it's mood swings, but it could also be mental illness, okay? For the guys, usually, since you're usually the hard ones, you never talk much, it could be as well as mental illness. It could be distress. It could be maybe a loan that you have. It could be because you haven't paid rent, or maybe you haven't paid school fees for the children. And that, until you really talk to a health profession, and in this case to talk to your general doctor, talk to your psychiatrist, talk to the psychologist, your counselor, you might not know that actually you're turning to the other side. Like I said, we are all on the mental health continuum. Yes.
Very interesting. We are still navigating mental illness and its challenges. And I'm glad you are still with us, and I believe you are picking lots of things from Dr. Raymond's submission. Very important. You do not know whether your neighbor is mentally ill or you're mentally ill. Please do take serious this discussion, and of course, start evaluating yourself. Where do I fall? Those who are always stressed, he'll advise when we come back, but we're going in for a very short break and return with this discussion.
Issues at Hand, powered by Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.
This is Church of Uganda Family TV, enriching lives. Issues at hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.
Welcome back. You are still watching Church of Uganda Family TV. This is Issues at Hand, and we are powered by Protea, a hotel by Marriott in Entebbe. The numbers are down there below. Please contact them for booking and reservation. They have very, very, very outstanding services when it comes to any kind of service you'd want from a hotel setting. So, well, today we are navigating a mental illness and its challenges. We have discussed a number of them so far, and of course Dr. Raymond Mugume is taking us through this. And now I want us to go into treatment and diagnosis of a mental illness. Doctor.
So mental illness, like I said, it's not well understood by everybody. And
Yes.
so it will be only prudent that for treatment and diagnosis, the best we can do for anyone who is watching, for our viewers, is that you know the symptoms, you know what the person is dealing, and then you signpost them to the right profession. And usually people might first signpost them to because you see with health, it's not like a car. Usually when the car gets a problem, they send it to the mechanic directly.
Yeah,
but with health, they first go to the witch doctor, then they go to the pharmacy, then they go to the neighbor. So by the time they come, really, there might not be much. So to answer to tackle the issue of diagnosis and treatment, really that is up to the health profession who will be in charge, or who will receive the person, who will receive the client. And at their discretion, they will determine what kind of mental illness it is. It can be bipolar, affective disorder, it can be depression, it can be schizophrenia, it can be an eating disorder, it can be a sexual disorder, or what you call sexual dysfunction disorders. It can be a disorder where people just want to set things on fire. That is also a disorder that needs the psychiatrist or the clinical psychologist in this case to come in. And so because our issues or mental illnesses, like I said, are not, they have been with us for very many years. But then it's one thing that we are starting to realize now, because one is that everyone has the smartphone, and so you can capture what exactly is happening, and then you share it with colleagues, and then they will tell you perhaps this person needs to go and see a psychiatrist, or they can go and see a psychologist. And the distinction between the two is that the psychologist does what we call talk therapy, prescribe drugs. Okay, so your psychologist, because they do not, their background, they are not doctors first. Well, as psychiatrists are medical doctors first, and then they go on to specialize to become psychiatrists.
Okay.
So they're medical doctors first, and then they become psychiatrists. Psychologists, on the other hand, they have a diverse social background, and so for them, they do not have the background to, or the license even to prescribe drugs. So you look out for them, because that is happening around us, that there are psychologists who are actually prescribing drugs to their clients. So and you should know as a client that you have rights, what we call patient charter rights, that you're allowed to go to your doctor or to your therapist and ask them what are their qualifications. Okay, it is your patient charter rights. And I want to emphasize it, because when I talk to clients, they usually say, if you ask the doctor, they will even leave you. But no, it is your patient charter right to ask the qualifications of your doctor. And also to ask about what kind of mental illness you have. Should they say that you have a mental illness, it is also your charter right to ask what kind of mental illness it is. So the diagnosis and treatment is really diverse. We have drugs, where we use drugs. We also have where we use talk therapy, but in most cases we use both drugs and talk therapy, because then with evidence that is coming up every day is that those two support each other, or they are cohesive when you use them together. But in some cases, depending on the level of your mental illness, usually talk therapy helps. And in certain disorders, usually we use other alternative therapies, what we call complementary therapies. Sometimes we ask people, or we recommend that people have the right foods. Then sometimes we encourage them to go and do exercise, we encourage them to listen to music, we encourage them to take nature walks. These are all complementary. They do not, evidence is not yet there that they necessarily treat mental illness.
Okay.
And then the other thing I needed to emphasize for those that have probably have relatives who are dealing with mental illness, or they're actually dealing with mental illness, is the issue of adherence, or taking your drugs as you should. Now, mental illness, because it takes time to develop, it is almost the same time that you might need to stay on treatment to bring it down or to control it. And so usually the minimum duration is usually like 6 months. But usually it is 6 to 8, sometimes depending on the episode. If it is your second episode, they will tell you 2 years. But this is at the discretion of between the client and the healthcare provider to understand how long the duration might be. And so I encourage that once you go in there and then you're told that you have mental illness, it would be very important for you to understand what kind of mental illness it is, the drugs that you get, what would be the side effects. All these should be explained to you, and you should also have the courtesy to ask. If the patient cannot ask, they usually go with relatives or attendants. The attendants can also ask these questions on what drugs is the person taking, what are the expected side effects, and how would we mitigate them. Do we have to wait for the next appointment, or we can come almost immediately should we see these side effects? Yes.
Very interesting. And when you did talk about some patients coming, first going to these other sources, like maybe charters, maybe any other thing. When is the best time? What is the best stage for someone who could be suffering mental illness? When is that best time for them to come for medical services?
Almost immediately.
Immediately they realize.
Almost immediately. Because like I said, what I'm doing here, look, is to increase awareness that, listen, we have lived with mental illness for more than 30 years in this country. Butabika National Referral Hospital was first came into existence in 1955. So those are more than 50 years that we've had mental illness. Even before that, before Butabika came in, we had mental illness. I mean, like in the 1939, the first institute, the first unit at Hoima Prison, which was for the mentally insane, was established. So we have had mental illness for a very long time. But we have not, because it's, like I said, we do not have even words in our local languages to explain certain mental illnesses. And so it has posed a challenge to both on our side and also to the clients, because they ask you, what mental illness do I have? And you have to look for a word that we do not have the words to translate them into the local languages. Like for depression, here in Uganda, you will hear people say enyike, but we do not have that in Runyorochitara, or we do not. I don't know if it is even in Itesot or in Lugbar. So there are those challenges that have come with how do we translate the English version of mental illnesses into the local languages. But that is something that colleagues are trying to work on, to tailor certain terms into our local languages so that we can increase awareness. And so, like I said, if everyone made mental illness their business, then it means that then everyone will have access to care. And what we are now doing as well on our side as healthcare provider is that we are also bringing services closer. So you could be, if you're like in Masolo, there is Faith Morida, where you can go and you get services. We are usually there every Thursday of the month. You can go to St. Francis Nkokonjeru. We usually also go there. And this is a way to bring services closer to people, because we have realized that there are those challenges that most of our patients are maybe coming from poor communities. They've become disabled because of the mental illness. They can no longer do much, so we want to get closer to them.
Okay.
And I also, on that note, I also wanted to clarify. You asked how soon. Like I said, it is as soon as you identify the person. Don't wait to first go to the church. Even when you go to the church, please, we want to work with our church leaders. We want to work with our witch doctors, that we can both work to save the patient. All our focus should be focusing on the health of the patient. We are no longer working in silos or working independently, that me I will treat mine and then for you treat. No, we are working together. In fact, most of our clients now, we tell them, hey, if you want to go to church, please make sure you continue your medication. And all we would ask of church leaders is to say, while you're here praying, please continue to take your medication. That would change a lot for our clients and for our patients in general.
Is there any special way to handle some people who are mentally ill? Like some people you see, let me just use the word off, they are totally off. And maybe they even they turn out to be beating people and all that. Is there any special way of handling such cases?
That is a very good question. One, I want to first make this statement, that most clients that are mentally ill, they're actually more vulnerable to violence than them causing the violence. In other words, they are victims of violence than them causing the violence. I don't know if I've made that clear. That because you're mentally ill, and for a very long time we have always conceptualized that mentally ill, that's prejudice. Patients with mental illness, or clients with mental illness, are violent. But on the other hand, they're the ones who actually are being violated. Their rights are being violated. They're the ones being beaten. They're the ones being tied. In communities, you find them tied on the tree. They're not violent, but because they are mentally ill, or they call them abalaru, or mad people. But they are not. If they had it to their benefit, they would have wanted not to have that mental illness, but it's out of their control. So the best way we usually do is that all you need to do is first talk to them. For those that are very violent, you can restrain them, physically restrain them. So, but you physically restrain them as you're taking to the health to the health facility. The other thing that alternatively that used to be before the Mental Health Act was passed in 2018 is that there used to be what we call the agency order, and this was with the laws that you go to the police, and it's still there, we still use it. You go to the police and say, we have a patient or I have a client, I have a relative who is beating people but is sick, and I want to take them to hospital. And then the police will swing in, help you pick the patient, and then they bring them to hospital. So it's the agency order. And then when they reach in hospital, usually there are very different modalities. We usually first talk to them. We don't rush into giving them drugs unless they are really posing a risk to themselves or to those around them. Then we use chemical, or we use drugs to calm them down. But most times talking to them is the best first step. But should you find yourself with a person who is mentally ill, is very violent, do not stick there and then call for help, and then see if you can restrain him before he poses a risk to you or to the rest that are around.
You did talk about companies maybe having a mental health work plan and all that. So where can we get services from, starting from that?
That is a very, very good question. One, I want to first say that for a very long time, we've had what we call rehabilitation centers. And these rehabilitation centers were not necessarily mental health units, although they were providing mental health services. Rehabilitation could go as far as talk therapy, occupation, or just getting you back to get skills, And so what the government has done so far is that all these rehabilitation centers that are offering mental health services have to be licensed, by the UMDPC. And two is that they have to be supervised by psychiatrists, And so that is a very good step in the right direction. So There are a number of them within Kampala here. But specifically to where you can get mental health services, we have both private and government institutions. Government institutions, we have now 17 regional referrals, and of those, 13 of them have mental health units. So we can go to wherever there is a regional referral, you go there, they will have the mental health unit, so they will have the mental health services. That is one. Okay. Two, if you're here within Kampala, we have actually 5 national referrals. We have Butabika Hospital, which actually right now is very overwhelmed. It's very full with clients. Then we have a Bosa Mental Health Clinic, which is on Old Mulago, and I happen also to serve there as well as serve in Butabika Hospital. Then we have privates. We have Lakeside, which is in Entebbe, which is by Professor Musisi Sengane. Then we have Nakasero Hospital. We have C-Care, for those that C-Care is formerly IHK. And we also have psychiatrists there. We have at St. Catherine Hospital on Uganda Road as well. It has services for psychiatry. Then we have so those are some of them. But to make it easier is that every regional referral has services. For those that prefer private services, they are also available. We have Nakasero, we have St. Catherine, we have IHK, we have Lakeside, we have Aurora in Namugonga as well. So we have quite a number of institutions that have come up to provide these services.
Okay.
Yes, please.
Very, very interesting. I hope this discussion has been so fruitful to someone out there. So as we wind up, because I see time has really taken us far, give us some last remarks in regards to what we've been discussing.
So my last remarks would be this, that mental illness, it's okay to have mental illness. That's one. Two is that all of us need to take the sole responsibility of making mental illness or mental health our business. Okay. It shouldn't be left to the professionals alone, or to the doctors alone, or to the nurses alone. It should be everyone's business to make mental health theirs to consider every day. Every day you wake up. Three, if you're already dealing with a mental health illness, or you have a loved one who is having a mental illness, there is care. Government is providing free drugs, and what we should know is that government has even increased the budget funding for access to medication of mental illness. So these drugs are there. We have them in hospitals. Three, healthcare providers, or the healthcare providers for managing mental illness are around. Okay, they're around. Myself and a team of other psychiatrists and clinical psychologists and occupational therapists, speech therapists, we work in a team. So do not lose hope that your loved one is done with life. No, they still actually have a chance to life. Support, be kind, be compassionate to anyone you meet with a mental illness. Let's be each other's keepers in terms of dealing with mental illness. Okay.
Well,
yes.
Thank you so much, Doctor.
For those that might need my number,
sure.
It is 0775 77 5511. You can reach me if you need more about this discussion. I'm okay to give these free talks to your workplace to increase awareness and to make sure that everyone makes mental health their business.
Wow. That's very, very important. Thank you so much, Dr. Raymond Mugume, who is a psychiatric resident at Makerere University College of Health Sciences. You have done us very, very well. I think very many people out there have gotten this information very clear. Mental health awareness is a priority now. It should be prioritized, because also I saw a report from the Uganda police that mental health should be spread, so that people do understand. people are in kind of situations they do not know. But if this is spread, then I trust someone out there will know what exactly is happening in their life. Thank you so much, Doctor, and I appreciate you, our viewer out there. Thank you so much for keeping it to Church of Uganda Family TV. This is Issues at Hand, and we've been powered by Protea Hotel by Marriott in Entebbe. My name is Luke Majumba Lenaito, and I want to wish you a lovely day.
Issues at Hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury